My name is Yash. I'm the founder of Pawzeeble, and I want to welcome you to a fresh new episode of the Pet Bet. So, how are you, ma'am?
All good, Yash. Thank you for inviting me. It's always a pleasure to talk about.
Perfect. हमारी पेट बेट के पीछे जो हमने शुरुआत की है, the reason behind that is कि हम ज़्यादा से ज़्यादा awareness create कर पाए within pet parents, so they understand what problems उनके pets जो है क्या problems face कर रहे हैं, and how can they be the best and the most responsible pet parents for their pets. So that is the reason behind us starting this. So we would like to know a little about you, your experience, your life decision on becoming a veterinarian. So please, ma'am, please tell us a little about yourself.
So I am basically born and brought up in Hyderabad. So having pets right from your childhood just kind of a trigger to become a vet. But I was one of my youngest students in my class that way when I joined the vet school. And once I finished my vet school here, I went ahead and pursued my first master's from NDRI Karnal, where I studied genetics. And after that, my inclination was always towards the clinical practice. I moved to US, and there I pursued my second master's and a PhD. Stayed there for almost a decade long, learned many things from them. I worked at a hospital. I'm a surgeon too. So uske baad mein I came back to Hyderabad. This is my hometown. I came back to Hyderabad, and then I started my clinic in here called Hope Animal Clinic in Hyderabad. It is in the compound of my house itself. It was fantastic. It's a very nice ambient place. And I was really not sure how I would take up, because there it was a very structured system. And I was so used to working in a structured system, but really, to be honest, I should say the acceptance has been wonderful, because people really like the doctors talking to them. And I was on a panel of counseling for terminal ailments for a really long time back there. So that training and education has really helped me in coordinating with my pet parents, creating a kind of awareness among them. Most important part, what I realized is, like, when I started my clinic from there till now, like when the pet comes down for the first time, jab pehli baar aata hai, to almost like 40 minutes is the counseling. I do a counseling right from the 40 days age till approximately the old age of the patient. All the 10 years, I tell them, is age mein ye karna, is age mein ye karna, is age mein ye leke jaiye. So this thing has really, really helped me. And most of us lack in this aspect, unfortunately. That is where pet parent and veterinarian bonding happens, Right. Jab aap 30 minutes spend karte ho in their first counseling, you both kind of come onto the same platform. Right. And trust me, the entire time I am standing, they are standing, and the patient is on the table. So utni der mein puppy it just plays around and everything, and right. So that way the pet also gets accustomed to the fragrances, to you, and to your tone. And right. It has been a record in my clinic. I do not have anything except a muzzle to restrain. हम कोई नहीं पकड़ता है मेरा clinic. No, wow. I do not have men. I do not have macho man to hold pets. Everything is done by pet parents. So this is one of the ways right. You really do it. So and then in past 5.5-6 years, my inclination grew towards cardiology. There are multiple reasons, multiple triggers for it. However, the major thought process, how it started was, the lack of emergency medicine facilities in our country. Right. Unfortunately, at least in my city, there are only hardly a couple of them who are trying to have a 24/7 clinic and all. But the basic understanding of the emergency is lacking. Correct. And I realized, education about the heart is absolute zero. So mera wahan se interest grew up. And I have a couple of my beautiful mentors who has been really helping me, both veterinarians, and I have a lot of human cardiologists as my mentors. Wow. So wonderful people. I attend more of cardio webinars of humans rather than veterinary science. One thing, because this is for the pet parents, मैं बताना चाहूँगी कि unlike human medicine, हमारी field में ना specialty sciences India में नहीं है. Right? So we do not have gastroenterologist, ophthalmologist, cardiologist. ये सब ologist veterinary medicine में नहीं है. So a veterinarian is expected to cut the nails, open the brain, open the stomach, do everything from top to bottom. It's not their fault. It's not the pet parents' fault. It is the kind of the system we are coming through. हमारे education system में ही नहीं है. किसी भी university में कोई specialty science नहीं है. So I have been struggling really hard for past 5 years to generate the awareness among the veterinarians as one clan, and also among the pet parents, so that if I can catch things early, right, I can handle them far better.
Ma'am, what can we do to, encourage these new upcoming veterinarians to, engage themselves into some kind of specialty, or how can we work with the government to do this?
Government का तो मुझे पता नहीं. I am just hoping down the lane, yes, there'll be some trigger कि कहीं पे कुछ चल रहा है तो शायद government को trigger हो. But I have started my own thing, wherein see, I struggled really hard. It was a very, very expensive thing because I went back to Sydney to pursue my cardiology. It was very expensive, extremely expensive. And once I came back, procuring those instruments was another huge expensive thing. So मैंने ये सोचा कि if I want to become a specialist, simple logic, if I want to become a specialist, I must have patients being referred regarding the same thing multiple times. नहीं क्या? See, experience is going to give you the expertise, isn't it? So and then I thought, no, it's more important for me to create the awareness of the discipline among the veterinarians. So I have been running a cardiology WhatsApp group. It's a very famous group now. It's called Vetcardians. And it's an extremely strict group. I am the sole manager of it, so मैं military role चलाती हूँ, to be honest. God bless them, all of them have been hugely respectful. I have very strict norms to join the group.
Right.
God's grace, we work very hard. I work every single day for about 3 hours in the group, every single day for past 5 years.
So vets across India are joining the group?
Wow. Yes, across the country. And during the lockdown period, we availed it, the opportunity, and we conducted 27 cardiology-specific webinars. Wow. And all the webinars were given by the members of the group, no special speakers.
Wow.
So that has generated huge interest. So, I have had a great success in that. I would say I'm very happy about it, rather, because my Vetcardians now, at least 25% of them are practicing cardiology on a day-to-day basis. Some of them has bought the echocardiography ultrasound machines, and 23 people at a stretch have bought ECG machines. And so वो लोग ECG खींचते हैं, group में डालते हैं, हमसे discuss करते हैं. See, every single day people are doing so much. And then God's grace, people call me for webinar, the lectures. I go out, this Kerala Association has called for a marathon lectures. I gave 7-hour lectures in one day. And then Pune Association has called. So is there people keep calling, and I give quite a few webinars through another company or Heal. So it has been a wonderful journey. And let me tell you, now among the young vets, itna zyada awareness hai, especially thanks to all the internet and the availability of the literature and the ease of communication. See, you're sitting so far, I'm sitting so far, communicating so well. Yes. So these things have helped so much that I'll just give you a small example about the curiosity that's been generated among the new vets. I declared there are just 14 positions available because I do a review every 6 months, and people who are the silent learners, we encourage them to leave. Only the participants must stay. Irrespective of your age, your CADO, your designation, just doesn't matter. So now I declared there were 14 positions available and we just put it in one single group by the Orihil. I just asked him, Daksab, just go ahead and put it in your group that there are 14 positions available for Vetcardians. In 30 minutes, I get 160 requests to join the group, and that too, 80% of them are either recent pass outs, final year students, PG students, or PhD students. So that's an achievement. So I feel, Yash, ki basically I have kind of triggered the flame somewhere.
Absolutely.
ऐसे ही करते रहेंगे ना, down the lane government को भी लगेगा ना कभी ना कभी. Private institutions
जल्दी लगना चाहिए. And
colleges को लगेगा. See,
what I've observed is your passion is inspiring. right? The passion that you're working with and the passion to learn for you as well, right?
Absolutely.
And then spread that
Yes.
knowledge. I
Absolutely.
feel that
It's
is
two-way
what is,
learning.
really like what people are relating to other vets, and that is why they are coming to you. So that plays a huge difference.
Yeah.
Yeah.
Thank
So,
you. Thank
ma'am, another question, like you said that you have practiced in a Western country for a specific period of time. So what are certain areas that you observe where, apart from, of course, like speciality is one thing, but are there any observations that you see in your daily course, which, where we can, as Indian enterprise or industry, can be better at?
See, we have a couple of things that we are lacking at, and we have a couple of things we are fantastic at. Trust me. Back in US, people have big setups, and many of them they work together.
Right.
Multiple vets work together, and so it's more like a synchronized system. And now, thanks to Pawzeeble, I'm using the software throughout. It has been very helpful. I'm able to get my data back. We are able to, coordinate with the parents very well. So that thing earlier, it was lacking. And then the second important thing, what I have observed back there is the awareness that the pet parents get about the pet right from the initial stages. See, यहाँ पे जो invariable breeding होता है, unfortunately, पपी का parentage हमें नहीं पता है, हम किससे buy कर रहे हैं हमें नहीं पता है, कोई registrations नहीं है, हमें genetic diseases के बारे में नहीं पता है, हमें ये नहीं पता है कि शायद उसका parent is diabetic or hypothyroidic, हमें सब कुछ नहीं पता है. But back there it is not like that. It's a very, very organized system. Right? And what we have that is wonderful and which is definitely not available back there is affordability. Trust me, उनकी currency के हिसाब से हम चीजें afford कर सकते हैं. As a veterinarian, I find I have a huge advantage of if I just give one single shout out to the rescuers. I'm associated with a lot of rescue groups. If I give one single shout out to them कि यार मुझे ना सारे 8 साल से ऊंचे के सब डॉग्स लेके आओ, मुझे कार्डियक इवैल्यूएशन करना है, एक दिन में मेरे पास 25 आ जाएंगे. So that data is very important to me. So whatever the standards that we have right now, whatever the books we follow, whatever the standards that we have, is everything as per the Western system. Right? My 30 kg dog is not equal to their 30 kg dog. You understand what I'm saying?
Right. Yep.
But still, I'm following their standards. I'm following their system because I do not have an authenticated data that I can rely on.
Correct.
So for past 3 years, I have started doing this. I make an Excel sheet of my every single cardiac patient who is coming in and वो repeat कब हो रहा है, उसको कितना लंबा मैंने बचाया है, और when did it leave. And how many times have they had a follow-up? So we are trying really hard to counsel the pet parents that maintaining the follow-ups at a certain stage of the disease is extremely important.
Correct.
First, early diagnosis is important. Second, maintaining a follow-up is important. आप बिलीव नहीं करोगे यश, मुझे ना जब मैंने अपना कार्डियोलॉजी प्रैक्टिस स्टार्ट किया, मेरे को अपने कुछ कलीग्स ने पूछा कि कितने की मशीन ली तूने? मैंने कहा यार जितने की भी ली हो, मुझे पसंद है, मुझे करना है ना. I want to create a difference. I want to see that arena. तो बोलते कुत्ते में हार्ट डिजीजेस होता है, तुझे लगता है? And this question is coming from a veterinarian. So it really pinched me very hard. So this is the difference. And why is this difference happening? Because it is not in our system. It is no one's fault. It's no one's fault. It's not in our system. Yash, can you believe we are not being trained in India how to talk to a pet parent? We are not being trained in India how to maintain a record in the hospital. We are not being trained how to manage our own emotions and stress. But all these things is a formal education system. It is a part of the curriculum in US. It's a part of the curriculum. And here, unfortunately, we are not being trained. See, I am practicing small animal medicine, और मेरे सिस्टम में मैंने गाय, भैंस, मुर्गी, बकरी सब पढ़ा है. मैंने कुत्ते का हार्डली पढ़ा है. So this need to change. I think private colleges are making quite few differences in that area. I have recently got some invitations from private colleges that they want to call me as an ad hoc professor. कि मुझे आप lecture देने के लिए तैयार हैं. I said right from the course outline, don't pay me anything. I'm willing to come down and teach because you need to start from the grassroots. And BVSC students are the best for that. So, and nowadays students are wonderful. They're very active. They're very agile. They're very, very smart. They're not like me. मुझे एक किताब पढ़ने के लिए 1 साल लग जाता है, उनको ऐसा पढ़ लेते हो. So it's like that. Yeah, that's the difference.
No, there's a lot of work, like from what you said. मेरे observation में बहुत काम बाकी है. But
लेकिन आप ये सोचिए, think in the other lines. You just need a different kind of an expression. बहुत work बाकी नहीं है यश. We have lot of opportunities.
Right,
it's
exactly.
An unexplored arena. It's a virgin land. I'm telling you, if any vet is listening to this, a young vet, I'm telling you, if you get into a particular stream now, you will make a mark. You can create, literally you can write your name in the history. Because
what we have observed is, the small animal industry has blown, like since 2019, like it has been growing so fast in numbers, and in like the overall industry is like pet parents have just started spending more, and they're okay with doing that, right? They are getting those opportunities as well. But apart from that, even the service industry where the veterinarians are also a part of, they also need to evolve.